And that's right. And not everyone experiences post-traumatic growth. And what's interesting is I used to write down all the things I appreciate at the end of the day. And it was only when I wrote my book that I thought, actually, this is what I've experienced. It's this phenomenon. And actually that CBT and trauma-based therapy has really helped me do those things. And I think the second point you mentioned about not everyone has to come and do all this awareness work is completely right. It's your own experience, your own journey. You do what you need to do to be able to live and thrive in your new normal. And it can be anything. It can be anything. You choose to define it.
Hello and welcome to the Thrive Against Cancer podcast, where we give a voice to the cancer community. My name is Toby Freeman, founder and CEO of the Robin Cancer Trust, cancer advocate and your host. Every episode we will be hosting open and honest conversations with people affected by cancer, whether personally, as a family member, clinician or charities and organisations. We will be talking to the cancer community about the cancer community and all the things that are important to you. Our guest today is a GP specialising in women's health and is a stage 3 bowel cancer survivor passionate about raising awareness of cancer, early onset bowel cancer, early screening, health inequalities and the impact of patient experiences on healthcare. Our guest today is Dr. Anisha Patel. Anisha, thank you so much for being here.
Oh, thank you so much for having me.
Especially in such a busy month for you.
Oh, it is. It's always the way. But what I always say is the work happens all year round, but it's great that we've got these months to increase public awareness and have people generally interested about their bowel health.
Absolutely. And for reference for people listening, probably in a couple of months down the line, we're recording this in April in Bowel Cancer Awareness Month.
Absolutely.
So I say to all the guests, it's over to you. Shall we begin at the beginning of your journey, wherever you want to start, either as a GP or your experience with cancer?
Yeah, sure. So I was diagnosed with stage 3 rectal cancer in 2018. In fact, it was September time, and I'm a GP. And at the time I was a partner. I was burning the candle, should you say, at both ends. I had 2 young children who were 6 and 5. My husband was a bowel cancer specialist. And I started to develop what I thought was IBS-like symptoms, some constipation, because life is quite stressful and busy, and so thought nothing of it. And then initially after that, I had a little bit of blood on the toilet paper, but I thought that was due to the constipation because I'd had piles after childbirth. But as time went on, things were starting to increase in terms of symptoms and intensity. And I spoke to my husband, who obviously clearly said, go and get checked, which I did. And the GP at the time said, well, let's try some treatment for IBS and piles, but if it doesn't go away in a month's time, you must come back, which is completely reasonable. I went on holiday, took the treatment, and things did get better. But at the latter end of my holiday in August, I was in Italy, and I was eating all the carbs you'd like, pasta, pizza, everything. And when I look back at the photos, I got smaller and smaller within those 2 weeks. And I wasn't able to run, but I thought it was the heat. And then the blood in the stool got worse. I was needing to go to the toilet urgently. I was waking up suddenly in the night, needing to go to the toilet. And I had 2 episodes of severe tummy ache. And I went back to the GP. And of course, I was referred under the 2-week urgent pathway. And then I was diagnosed with stage 3 rectal cancer, where I underwent 2 operations, major surgery, one where I had my stoma formed and the tumour removed, and the second one to reverse the stoma. I also had 3 months of really grueling chemotherapy. And I guess subsequently then it was trying to navigate that new normal, which is what I found really, really difficult.
Absolutely. And within all of this, I know you're medically trained and your husband is an expert, but you're still a person and a mother, and all of this is happening around normal life as well. That must have been, as it is for anyone with this sort of diagnosis, so jarring for you.
Yeah, it was. And I think, this is a message for all those people out there, particularly women who are busy working, trying to juggle a lot of things. Sometimes we don't put our health and prioritize our own self-care first. So getting your smears done, examining your breast, going to the doctor in a timely manner. And I think, in hindsight, was that one of the issues there? Or was it that I thought that actually something more plausible was going to happen, or the symptoms weren't that severe in the first place? It's difficult to know, but actually, we know that initially sometimes bowel cancer in the early stages doesn't even have symptoms, which is why we've got, the bowel cancer screening program. But I think, having this diagnosis as medics it was completely life altering, as it is for anyone. But I think for us, it was very much a double edged sword the whole time, particularly for my husband, who was always worried about the next step ahead, and had far more knowledge about consequences, and etc.
Yes, sometimes knowledge is obviously power, but I imagine that knowing all of the outcomes can be very anxiety inducing as well.
Yeah, and that's the thing, when I go back to med school days, and that was 18 years prior to my diagnosis, I remember standing on the surgical ward and the professor of colorectal surgery or bowel cancer surgery saying to me that someone with my stage of cancer at that point would have had a 50% chance of surviving 5 years. And all that was going through my head with all the stats that I'd learned over the years. Clearly, thankfully, things have evolved since then and treatments got much better. And year upon year, survival statistics are improving. But it doesn't take away that fear and that uncertainty, and the fact that actually there is still that chance at stage 3 of a later diagnosis of not as good outcome as someone who is diagnosed earlier.
Absolutely. I have to ask, although it sounds like you had the encyclopedia in your head already, did you Google? Did you fall back on Google at all? It has to be asked.
I actually didn't. I probably buried my head in the sand. I had my husband advocating for me a lot of the time. I think I went into shutdown mode and was just wanted to be told what to do. And I didn't want to know anything more in the early days. I did ask my oncologist what my survival rate was near the end of chemo, and she gave me a really good answer. And it's something that Dame Deborah James used to say as well. She's like, never Google a stage 4 diagnosis, because actually you won't get anything positive. But my oncologist quite rightly said to me, we're not a statistic. And actually, all the studies that have been done about survival don't represent me.
Yes.
They don't represent the fact that I'm Asian, that I'm female, that I was 39 at the time. In fact, they're all mainly Caucasian men over the age of 60. So this, for me, has been one of the things that, I really wanted to work on in terms of health inequalities, is making sure that we have data that's representative of all communities, of all age groups. Yes, bowel cancer in the young is rare, but we know there's a 22% increase in those getting diagnosed with bowel cancer in the young under 50. So we should be doing all we can to get data to ensure that we have those answers for the people that are asking for them, that they can actually then make, informed decisions, can have knowledge. It's not always helpful to have survival statistics, as I say, and, we don't represent everyone, but sometimes actually you can feel even more an abyss when actually none of the studies out there represent someone like you.
And actually, someone without a medical background may not take that into account when they're thinking about it, right? They just see all the stats. They're not thinking, this doesn't represent me. This is just the be all end all. I'm seeing a stat on a professional website. So that's really
and they'll take it as that's them, and that defines them. And that's why statistics don't define our outcomes. And there are lots of people who are defining the outcomes out there, which I'm so pleased to see. And actually, as we're getting novel therapies out there and earlier diagnosis, survival is improving, but we haven't caught up with the studies yet to look at those newer techniques. So I always want to give people that hope as well.
Absolutely. So I suppose this conversation leads on from what you've been through. At what point of that journey did you think, I'm going to start advocating? Because you said you buried your head in the sand and your husband advocated you at that point. You had chemotherapy. Was it during the chemotherapy, afterwards? At what point did you think, I have a voice?
It was actually on my way home from the colonoscopy. Literally hours after I was diagnosed, I said to my husband, you know what, you work in this field, and he's wanted to raise money with friends for years for Bowel Cancer UK, etc., because this is his work. And actually, I remember him saying this, and I said, this is our time. We've got to transform this negative that's just landed on our doorstep into a positive for ourselves, but also for our young family. This was about to turn their lives upside down. And I knew I wanted to do something positive. And maybe that is the slightly altruistic nature of doctors wanting to do something. It's not for everyone, but for me, from the forefront, I was like, let's do this. And at the time, obviously, a few weeks went by, but one of my friends said to me, why don't you start writing about it? Why don't you do what Dame Deborah James did and sort of document from a doctor's point of view what it's like to go through this? And maybe you might find that some sort of help to your own healing and your own experience or journey or whatever you want to call it. And so one of my best friends, Jude, she sat with me while I was waiting for my oncology appointment. She set up my Instagram account. I had very little social media presence before cancer. And she set up this account that a friend named Doctors Get Cancer Too, which was just really what it says on the tin. And from that day forth, I started literally writing my way through cancer and then trying to scurry information, research, take in what my experts were saying, what my husband was saying, what studies were saying, and try and then give other people that information that I was squirreling away for myself, and formed a community. And from then on, I work with charities like Bowel Cancer UK and now the ambassador, and wanting to use my voice, my unique voice, I guess, as a patient and a practicing doctor to try and make change. And that's really where it all started from.
That's amazing. Did you find it really helped you through that journey, as we'll say, for want of a better term, going through it? Did it help the journaling? Did it help? Did you find that was a release for you as well?
Yeah, I never thought I would write as catharsis. I was never a great writer at school. It was probably my weak point in terms of subjects, but actually cancer gave me that gift because I felt that writing through pure emotion actually really worked, and people found it really relatable. It was authentic, and it was authentic to myself. And I used to use it as therapy. So I would write it in my notes in my phone. A week later, I'd post it on Instagram. I would shut my eyes and not look at all of the comments. And then I'd go back and see, oh my goodness, like people are actually relating to this. And then I would read it to my therapist. And that was then closure of that chapter. And then I'd move on to the next thing, the next sort of hurdle I had to get over. And I continue to write now, not as frequently as I used to, but I still write about life after cancer and the juggles, even to this day on 6 years. And I think I'd like to think that people still like to hear that authenticity when they're on their own experience stroke journey, to say, actually, no, it just doesn't stop as soon as you come out of cancer treatment. Actually, there's still ups and downs several years on. And I think that's really important that we do show people both sides of it.
Yeah, absolutely. Because just coming out and showing everyone new you, the great world, like it's just, it almost puts an unobtainable goal on it because the other stuff still goes on. Do you want to dive into some of the ongoing effects and those things that you talk about?
Yeah, so I think there's obviously the physical effects. So for me, when I signed myself away on my consent form, one of the side effects is having bowel dysfunction, which means you'll never poo like you did previously. And what that means for people who've had half their rectum and part of their bowel removed is you've lost your storage capacity. So I will go multiple times a day. It often clusters, which means you need to go in quick succession. You might need to go urgently. You might have diarrhea, constipation, tummy pains, rectal pain. And it's something called lower anterior resection syndrome. And unfortunately, there's very little research into this condition because actually when surgeons were taking bowel cancer out, the aim is to obviously cure you of your cancer. And absolutely, 100%, I want my cancer gone. But actually, as more and more people are getting diagnosed younger and younger, that's got a massive impact on quality of life. And we know it has a massive impact. And I know people that can't leave their house sometimes because of it. So thankfully, more research is being done. And it's something that I'm really pushing for. And I've had to learn tools along the way because there aren't the studies. And it's been trial and error. And again, that was something that I documented. Then we've got the nerve issue. So some of the chemotherapy, it destroys the nerves in your hands and feet, particularly sensitive to cold. So I still struggle with like really cold, cold, or wear bed socks around the house, can't chop up fruit, frozen anything, or cold meats or anything, or cheese. And then you've got the mental health effects. And I think for a lot of people, that is one of the biggest fallouts post cancer, because when you're going through treatment, you're on this conveyor belt and you're very much, let's just get on with it. Go from pillar to post, never really absorbing or taking in or processing everything that's happening. And I never really thought of it as trauma, but actually it was something that I had to learn to accept, that actually I did have PTSD. I found it extremely difficult being the patient. That loss of control for me was a lot of the trigger for my PTSD and my anxiety, which I never had mental health difficulties in the past. And having to manage that with trauma-based cognitive behavioral therapy and finding my tools to maintain my mental health has been tricky, because ultimately we're all living with that uncertainty and fear of cancer coming back. We're having to go through the regular scans, the colonoscopy, the surveillance. And that's a whole new normal that people often underestimate. But it was something that I was quite vocal about, because I thought, actually, if you don't explain to people why you might be a bit out of sorts, it's very difficult for people to then understand what it is that you're going through. There's obviously the impact of fertility as well. I was asked before I started chemotherapy, was my family complete? Thankfully, I'm lucky to have 2 healthy children, and I said it was, but that is a huge issue for those diagnosed young. And on top of that, there's the early menopause that I've gone through. We know that people that go through menopause earlier because of chemotherapy, radiotherapy, surgery, so an induced menopause, often have worse symptoms. And it's been named a crash menopause because often the menopause happens suddenly overnight. Symptoms are worse. It's not managed as well. And that's another thing that we need to work on. So many things to work on. Haven't got enough hours in the day, but yeah, it's something that people often don't think about. And then we have the impact on relationships, on work, all these other things. And I think that ripple effect that cancer has on everyone and everything is often, you don't really know about it till you go through it. And it's like, I describe it like a grenade bomb that suddenly goes poof, and everything suddenly is in disarray. But piece by piece, with an army behind you, with tools, with therapy, with medication, it is possible to rebuild, regrow, and I guess redefine yourself, and a perspective is changed. And that post-traumatic growth that I experienced has been really profound on my life. I've done things I never thought I'd do. I've tried things that I never thought I'd try. I've lived the last 6 years that people might live in 20 years, because there has been that urgency to live. That's not always a good thing because it's exhausting, but I definitely feel that actually as my family, they notice it. It's like, right, okay, Anisha, put the brakes on. We all need to sit down for a minute and just take a moment. And I think that's really important to just pause and reflect just how far we've come.
That was just an amazing answer. I was just basking in that. It was brilliant. Post-traumatic growth is not a phrase I've heard before, but I've got a big underline, which I think is such a beautiful reframing of what you've been through and what can be achieved afterwards. And I think that the most important thing is that's always that's individual as well. I think you're not saying everyone needs to come out here and be a massive advocate and be on social media, and there's not this pressure. Actually, post-traumatic growth can be that can be maybe getting out the house, that may be talking to your friends and family or going to see a therapist. It's those little steps to that growth.
What's interesting is I used to write down all the things I appreciate at the end of the day. And when I was writing my book, I didn't realize I was writing new experiences, seeing things through a different perspective, maybe finding some spiritual or religious, guidance, all those sort of things. And it was only when I wrote my book that I thought, actually, this is what I've experienced. It's this phenomenon. And actually that CBT and trauma-based therapy has really helped me do those things. And I think the second point you mentioned about not everyone has to come and do all this awareness work is completely right. It's your own experience, your own journey. You do what you need to do to be able to live and thrive in your new normal. And it can be anything. It can be anything. You choose to define it.
That's amazing. And I think just everything you've just talked about is a brilliant surmising of why we put the podcast together as well, because all the things you're talking about are relevant to people with different cancers as well. It's not just bowel cancer. You know, talk about early menopause. We've had ovarian cancer guests in who have had the crash menopause literally overnight, and this trauma and the growth. Can I just ask, when you identified, you've talked about therapy a lot. Was that something you identified early on, or was that something you were already doing pre-diagnosis?
No, I've never had any mental health issues. Was really lucky. And then when I was diagnosed, I straight away organised for the children to have play therapists who were attached to a charity to my hospital. So I was very lucky that we had this holistic centre as a charity attached to the hospital. So they were my priority, making sure my husband was okay. And I was like, no, I don't need a therapist. I'm fine. And then they said, let's just book you in one. So it was actually 3 weeks after my first major surgery. I went in for my stoma reversal, and the therapist came onto the ward. And just as well she did, because I cried for 3 days straight. It was the first time it hit me what had happened. And that's when I wrote in hospital. I started writing and blogging about everything that had happened. And I said, I'm so glad. It's like an angel had been sent. And I said, I was telling you all that I didn't need a therapist, and you all knew. You just all knew from when you met me and the way I am and my family set up, and they just knew. And I went on to have 18 months of counselling with the same therapist, at which point she said, actually, I think you need trauma-based CBT because I think you've got PTSD. And at that point, I went through NHS pathways to get referred. What I want to say here is I didn't click with my first therapist for trauma-based CBT. And I'm just to say to anyone out there, because I hear it from my patients as well, if you don't click with a therapist, that's okay. It doesn't mean it's not going to work for you. It just might not be the right person. And so I was very diplomatic, and I just said, at this point, actually, this isn't the right therapist. Actually, they're making things worse. And I know with trauma-based CBT, things sometimes get worse before they get better. But I just felt it wasn't right. And actually, I went on to have another therapist who was amazing. This was through lockdown, so all my therapy was online. And it was really hard work having that trauma-based therapy, but I'm really glad that I had it, and I recommend it to anyone. And also my husband went on to have therapy, something he's never had to do, but his was actually 9 months after I finished treatment, where suddenly that cortisol just went, and he was allowed to stop acting, I guess, on my behalf as a medic and being very functional and getting us all through, getting the family through, carrying on working as a full-time consultant and delivering bowel cancer news to people every day. And he obviously needed it as well. So I think it's really important not to forget the carers and the other people in your household or who help you as well.
Yeah, we do hear this a lot on the podcast, is the person going through it is usually worried about everyone around them. They're all worried about the person going through it, and then everyone has a crash right at the end.
Basically.
Well, you're just in practical survival mode, aren't you? Constantly.
Exactly.
And that's only sustainable for so long. So amazing advice. I think that's a good segue into your role as a GP. And we talked about this in our pre-call about how people can come to you if they're concerned about cancers. What are the things people should be maybe saying when they're going into a GP appointment?
Yeah, so I think it's really important to have in your mind what you're worried about. And as GPs, we're taught to talk about and think about patients' ideas, concerns, and expectations. So if you have in your mind what your ideas are about your symptoms, what you're concerned about, and then what you're hoping from the consultation, and explain those to your GP, it can really facilitate something that is more fruitful to you and making sure everything is sort of checked off. And I always say to patients, be prepared before a consultation. Don't just go in and wing it and say, oh yeah, I'll just sort of, it's been ongoing. Have in your mind, what are the dates? When did it start? How often is the bleeding or the pain? How much weight have you lost? How often are you changing your tampons if it's for heavy bleeding? So having these key dates and information is really, really important. And I always encourage symptom diaries. So you can get these for headaches, for periods. You can even get one for bowel cancer symptoms on Bowel Cancer UK's website. So actually, it's really easy for a doctor to see in black and white what the trend is for your symptoms. And when you go in, if you've got lots of problems, try and prioritize on the most important one. So if cancer's your worry, get that one out first, because that is the most important one that they focus their information on and prioritize. And if you've got photos, for example, so sometimes people come in with skin moles, etc. If you're worried about a mole, make sure that you have a picture of it, say a few months ago, and then why you think it's changed, and I could have a look at it then, and make sure they're to hand rather than sort of having to go through. I've been there for ages with patients going through libraries of photos trying to look for one. Have a list of your medications, any alternative medications, what you've tried so far for your symptoms. And remember to ask questions. You know, if there's something that you're worried about, never feel too embarrassed. We've heard it all before. This is our job, day in, day out. One arm is the same as another arm, is the same as a vagina, as a testicle. It doesn't bother me what part of the body you're talking about, because for me, it's very almost medicalized in that sense that, you know, a toe, you could be talking about your toe or your anus. It just doesn't matter. And if you feel nervous, if you feel embarrassed, please do tell your doctor, because we will take that extra precaution and time with you to do what we can.
Absolutely. And I think we talked about this as well, especially in cases of cancer, things like family history, which I know you work to break down those sort of stigma and taboos of having those conversations with your family to find that out. But that's really important in context giving for GPs as well. I often go in, if I've got a concern, I'm like, brother, mother, other brother. I'm like, I've got a real history of this, and then that's why I'm concerned. And that might be why my anxiety's high, and you might be able to help alleviate that, because that's part of it.
And I think that's really important. The family history thing is crucial for a lot of cancers, but also for us to realise the impact on that patient, as you say, because actually your anxiety is going to be heightened. And we see that a lot, particularly with breast cancer patients. You know, my mum's had breast cancer. And I'm like, absolutely, we need to, you know, obviously we would chuck out any lump, but in the context of that family history, it is important to know, if you can, ask in advance of any conditions that people may have had.
And I hope you'll agree with me on this, but going back to what you said about advocating for your own health, second opinions are okay as well. If you've gone to a GP and you're not quite clicking with that GP, that happens sometimes, you know, maybe it just feels like there's a disconnect. It's okay to go to another GP, right?
Absolutely. You know, if you feel worried still and you've explained all your ideas, concerns, and you've given your expectations and you've been concise and, you know, gone through the things that I was talking about, and all the information has been given, and you still feel that your symptoms are there and you're not happy, please do seek a second opinion, a third opinion if needed. You know, I do want patients to advocate for themselves. And we are very much in that era where we know patients should advocate for themselves. I would never feel offended, actually, if someone said, I'm coming to you for a second opinion, or actually, I'm going to go for a second opinion. That's okay. That is okay. And so, yeah, absolutely. And I've had patients even say to me, I'm not getting anywhere in my surgery. And I've said, well, move surgeries then. If you can, then move surgeries. And if they've done the right tests and examinations, then hopefully that can draw a line under that and reassure you that things are okay.
Do you see a difference in, as a GP, in younger people advocating slightly better, just because of like information that we have access to over perhaps the older generations who I would say perhaps either avoid the doctors or take doctors' words as absolute gospel? Or do you think that young people are still perhaps just, there's that barrier of, you're young, you're healthy, it's probably nothing? I was just interested to find out.
Yeah, I think we've got two camps. I think we've got the camp that absorb a lot of health information on social media, a lot of which is misinformation. And that's really difficult to tackle then when they've seen it online and trying to say to them, actually, that's wrong or right. But it also fuels some health anxiety. So we may do all the tests and everything's normal, but actually for some people, it's become more difficult. But we also know it's educating a lot of patients as well. If they're taking in on their social media health content, they are going to get that awareness, because there's lots of doctors out there like me who are trying to put correct information out there. But we've still also got a camp who may not be digesting that sort of health information, unaware of symptoms. And Bowel Cancer UK did a very important study called Never Too Young, and it showed that 1 in 3 people didn't recognise that blood was in the poo was a symptom of bowel cancer, and these are people under 50 who are diagnosed. And 1 in 4 people cannot name one single symptom of bowel cancer. And I think that there is a delay of people being diagnosed with under 50 in all different types of cancer for 2 reasons. One is education and awareness that cancer doesn't discriminate, or they're unaware of the symptoms. And so there's the public awareness. And then what we're also trying to tackle is the healthcare awareness, making sure that, people know, healthcare professionals know, doctors know that cancer doesn't discriminate as well, and that no one is ever too young to have cancer, and that we have got tests, for example, the poo test for bowel cancer now in primary care that we can do and easily access to give us a good risk assessment of whether or not that person needs further investigation for bowel cancer. So I think there are 2 issues there when it comes to driving uptake and education of cancer in the young. It's still rare, but it's still happening, and we are often diagnosed at stage 3 or stage 4 because of these 2 issues.
Absolutely. I've got so many follow-up questions. So excited. There's so many things there, isn't there? So I think maybe the first one is, why is there an increase in young people getting bowel cancers? Big question, just throw that on you, no pressure. And then, what is the work being done to raise awareness publicly? What more can be done, and how can we tackle that? And then the doctors as well. How do we access the doctors to make sure that they're understanding that this information from young people getting cancers earlier is getting through to them?
Yeah, so we'll go with the doctor one first. With the doctors, there are people like me and health educating, health professionals. Charities are taking that on board. So big charities like Cancer Research UK, Bowel Cancer UK, the Eva Peel, who do gynecological charities, they're all providing healthcare information to highlight these issues. It's being taught in training courses, because I often get screenshots from my friends saying, "Oh, cancer of the young." They feel they've got big brownie points. So, it is something that is more and more also in the media and the press, and it's something that we are becoming more aware of. We know that there is a global rise of a variety of cancers, including bowel cancer, lung cancer, breast cancers, head and neck cancers in the young. Traditionally, it was things like testicular cancer, cervical cancer, but we are seeing rates of bowel cancer in the young equivocal to that of cervical cancer and testicular cancer for all age groups. So, these, although we say it's rare, it's still reasonable figures, 2,600 patients a year. And what we think is, we know there's been a 22% rise since the 1990s in cases under 50. And in 50 countries that were studied with this increase, potentially in the under 50s, we found that 27 out of 50 countries around the globe have seen similar increases in the risk of bowel cancer. So this is like a global epidemic, and it's also happening in other cancers. So why? And that's a really, really good question. And we know that with bowel cancer in particular, 54% of bowel cancers are preventable. We know that fibre accounts for about 30% of those cases, i.e. a low fibre diet. And in the UK, we know 9 out of 10 people aren't getting enough fibre, and that's 30 grams a day. So you've got a huge risk factor there. We know that red meat and processed meat consumption increases your risk of bowel cancer. Smoking, being overweight, having a sedentary lifestyle, and alcohol also increases your risk. And these are all modifiable risk factors. But there are people like me out there who didn't have these risk factors, who had no family history and still got bowel cancer. So that has been my question. Why? Is it just bad luck? And I'm really fortunate to be working on a huge project for the next 5 years, funded by Cancer Grand Challenges, which is investment from Cancer Research UK and the National Institute of Health and the Bowel Babe Fund. And they've got £20 million to try and identify novel risk factors for bowel cancer in those under 50, to hopefully then formulate some sort of risk stratification tool to identify those that need to have screening, for example, earlier, to ensure that we can catch these people at an earlier stage, and perhaps give them health intervention advice as well to try and reduce that risk. Now, we've got loads of hypotheses. This could include microplastics, ultra-processed foods, the gut microbiome. We've identified a bacteria from the E. coli species producing a toxin called colobactin that we know can increase your risk of colorectal cancer, and so many other things that are being looked at. And we've also got the UK Consortium of Early Onset Colorectal Cancer, which I'm part of as well as a patient advocate, who are also looking at similar things, because actually we've got to work fast on this, because by 2030, we think the bowel cancer in the young will have doubled in incidence.
Wow.
And we're seeing this in other cancers too. So if we can look at these new risk factors for bowel cancer, there's nothing stopping us looking at that for breast cancer, for the other cancers that are increasing in the young as well. We want this research to be translatable to others because it's impacting a lot of cancers.
Absolutely. And when you get to prevention or lowering risk factors, that's obviously across the board as well. When you talk no alcohol, less alcohol, moving around more, not smoking, all of those things are going to lower your risk across the board.
Absolutely. And I think that's all we can say to people is living that healthy lifestyle. You know, I don't live like a saint. I think everything should be in moderation, you know, but actually there are loads of ways to eat really well. And that's a whole different conversation that government could sort of amend food policy to help that here in the UK, to help us all eat better. But there is so much that we can do. And fibre is one of those basic things that will help so many people. I'm on a mission to make fibre sexy, I'm telling you, because it's one of the most underrated nutrients. People talk about carbs and glucose and spikes and God knows what, but actually we should be talking about fibre, because fibre not only reduces your risk of bowel cancer, it reduces your risk of stroke, diabetes, heart disease, it reduces your cholesterol, it keeps you fuller for longer, it helps your gut microbiome by feeding it. We should be really aiming for 30 grams a day. And actually, to get 30 grams in your diet, you have to think about it. So next time, look in the supermarket, look at how much fibre is on the back of a packet, because to get 30 grams a day is hard work. And if you are going to increase your fibre, having listened to this, do it slowly, do it with an increase in water. Otherwise, you will get a bit of flatulence and stomachache. But if you introduce it gradually, there should be no problem.
Amazing. So I was just sitting here thinking, do I eat enough fibre? I don't know. What's some high fibre foods that we can be starting with? Please tell me porridge is on there, because I eat a lot of porridge.
Porridge is on there, but I would put a tablespoon of chia seeds or flax seeds.
Flaxseed for me, yeah.
That's it. Into that. Berries are high in fibre. Nuts, seeds, whole grains. I also talk about fibre swaps, so swapping your white breads, your white pastas, your white rice to brown, really increases the fibre intake. Keeping the skin on vegetables, on fruits, increases your fibre. You know, people think that eating smoothies is great, and there's nothing wrong with a smoothie. My children love a smoothie as well, but actually you sort of take all the fibre out of that and you want all the skin and the pips and everything. So it is about trying to find these things. And in the supermarket, you'll find there's things with a source of fibre or high in fibre in. The high in fibre ones, packaging will have more than 6 grams per 100 grams of weight of fibre, and the source of fibre will have 3 grams per 100 grams. So it's worth looking out for these labels, but then just checking on the back what it is. Kiwis are brilliant. They've got soluble and insoluble fibre. And if you have any gut issues, they are what I prescribe to so many of my patients. In fact, I think I've even taken kiwis on TV to show, because I'm that obsessed with kiwis. But unfortunately, my son's allergic to them. It's like, oh, God, really?
Oh, excellent. Well, thank you for that advice. As you were talking there, I was thinking this is something I think you're really passionate about as well. And this feeds into it. Healthy diets. And we get, I've learned a lot about ultra processed foods and, trying to reduce that. But there is a cost implication to that. And part of this comes back to the health inequalities, because lower income families don't have as much access to buy organic, to buy whole grain. And, that's one of those health inequalities I reflect on often, because I'm privileged enough to be able to worry about my processed foods. But I know other families aren't. And it's a difficult balance being told what not to do if you don't, A, have the education around it, and B, don't potentially have the money to be able to spend on these foods that are better for you. So health inequalities comes in a variety of issues, isn't it? And that's just one small factor on it. Is that something you want to just dive into, what you're seeing, what's being talked about from the medical side as well?
I completely agree with you. And so I think that's why sometimes when we see people talking about chia seeds and organic this and that, these things are expensive, quinoa. And so when I do talk, particularly in the media, when we're trying to talk about, wholesome lifestyles, and we're very mindful about what we are talking about and what we are suggesting, because food has gone up in price. And actually, this is one of the things I was saying to you about food policy. This is something that really needs to be addressed. And we need to make whole foods, wholesome foods, accessible. What we do say, though, is we also can do food swaps, in that, a tin of beans, a tin of lentils, all those things are cheap. And you can make a lentil bolognese with a tin of lentils, a tin of cheap chopped tomatoes, and a few herbs and things, instead of having a beef bolognese, for example. And we try and talk about swapping out maybe more expensive ingredients for healthier, actually cheaper ingredients. I love frozen veg. I love frozen fruit. And in fact, do you know what? Sometimes they maintain more vitamin C and nutrients than fresh products because they're frozen at source. And frozen veg is often cheaper. Tinned veg, these things are often cheaper. So I will always have drawers full of frozen veg and fruit in case I run out of fresh. Or actually, if I'm bulk cooking, that's a great way to add in some extra, a handful of sweet corn, handful of peas. And these things, once you get into the habit of having certain things on your shopping list, it's making those small changes. And I'm glad to say some supermarkets are trying to do sort of the more cost-effective lines of things like sweet corn, of peas, of healthier nutrients. But it is thinking about, a tin of baked beans, actually the low sugar ones, they are a great source of fibre. They've got pulsive beans, which are really healthy. So I think what it is thinking about batch cooking. I love batch cooking because I am time poor as well. And batch cooking on a Sunday with the music turned on loud, have a bit of a boogie, it's actually really cathartic. I find it quite mindful, and I'd recommend it to anyone, or in an evening, I sometimes do it at 6:30 in the morning. I'm just like, get everything out and just whiz up loads of different things, but swapping in different ingredients. And I think that's key.
Absolutely. It's totally agree with the policy changes as well, because when you were talking there, I was just thinking about, I don't know what it is now, but there was a lot of ultra processed food in my school for school dinners and everything. That's a major issue because that's what you learn, and then that's what you like, and then you go home and ask for more chicken nuggets and ultra processed chips or waffles or things like that. So it is education, isn't it? A lot of our guests talk about education. I think the curriculum, PSHE, has a time and a place, but there needs to be a real push towards these drivers on a whole change national scale, so that we can be educating from very young and just ingraining healthy habits at a young stage. Exercise, food, certainly, alcohol, smoking, all of these things, vaping, that we know are risk factors, that we can start. The next generation should be from, day dot, they should be learning that these things can be working in their benefit or not. So
and that's absolutely key. And I'm really passionate about younger generations and their education in terms of what you've just said in lifestyle. We should be teaching them about nutrition. We should be teaching them what formulates a healthy lifestyle, giving them tools to help with their mental health, but also talking about knowing you're normal. And I think that should be done at a younger age, because we as a society have created that taboo and that stigma around body parts, which then leads to me seeing patients that are embarrassed to come to me to talk about their issues, because we've not talked about it. We've not talked about and used the right words, vagina, bottom, anus, vulva, breasts. We've given them all different names. It's all become a little bit of a laughing game. And that's, with children, but actually they need to know what their body parts are. And the number of people who say to me, I've got a problem down there, downstairs, and I have no idea what they're looking at. And sometimes the patients don't know as well. And I think we just need to be teaching people about their own body parts, surely, so that they know what to check.
So important. I've got a theory. I think I might have talked about this on the podcast. Sorry if I'm repeating myself, but it'd be interesting from a GP's perspective for younger people as well. When young girls are going through periods and menstruation for the first time, there seems to be a bonding experience of talking about that and finding community. Whereas in boys, everything especially becomes a banter and laughing. It's all about your voice breaking, who's got the first pubes, your balls dropping, all of that. And it's all, especially I can remember from my experience, it's all, it becomes this sort of alpha, who's got it first, and then taking the mick out of everyone else. So it becomes really ingrained and tabooed at that point for boys. And I think we all know there's a massive issue, and I know Eva Peel talk about this a lot, about mislabeling of female body parts or misunderstanding of where they are in the body. But for boys, I think there's just this overriding stigma of anything in the private area, i.e. testicles and penis, just open season for banter and nothing else. And that's, I get there's part of a bonding thing there, but it's something we need to break down, just normalizing all of this. And I think a lot of this starts at home, family history, we need to be talking about grandma had this and granddad had this. And we always knew we were the heart disease and diabetes family. That was our jam. Yeah. We were not a cancer family until my brother was diagnosed. Now we seem to have become a cancer family, unfortunately. But at least we talked about these things. And I think it's really important in breaking, like you say, the taboo and stigma. I guess it's just, what are your thoughts on how we do that as a general populace? Because I know the medical professionals want us to do this. What conversations can we be having?
I think it is having those conversations, as you say, that start from home, because at the minute it's not totally in the curriculum, but it's something that we really aspire to do, because there are still some generations, some households and some communities, some ethnic minority communities, that would not feel comfortable doing this, because it's not been the done thing, because there is that shame and stigma and taboo associated with that. I don't think we talked about this in my household. I mean, I talked about periods with my mum, but we didn't talk about or name body parts as we would. It just wasn't done. And so this is something that, my children get sick of it. And they're like, Mum, do you really need to keep talking about vaginas on national TV all the time? Well, yeah, actually I do. But they actually can see what I'm doing, because actually there is an importance in this, because a lot of people don't know the difference between their vulva and vagina. So how will you know if something has changed on it? So I think firstly, we need to have these conversations at home. We need to then hopefully get these conversations into school and onto the curriculum. And we need to be talking about this on social media, which many of us are, and using the right words and not getting shadow banned by people like Instagram and other people, because a lot of people, including myself, have been when we've spoken about these aspects. And I remember having complaint about having we had vulval cupcakes on Lorraine to show what different vulvas look like. So we had different icing and different shapes of vulvas to demonstrate that actually everyone's looks different, so don't worry. And someone said, well, why would you be talking about that at 9 a.m? This is just scandalous. But that's exactly the issue, isn't it? Someone is seeing that in a sexualized way.
Yes.
Whereas I'm trying to educate someone about the fact that vulvas look different, and you need to actually put a mirror and look at your vulva to know if you suddenly get a vulval cancer or you get a rash or something changes. And so I think this is what we're always faced, and we're still sort of banging our heads against this wall. But we will keep going, and we will all keep trying in these communities that we work in, and that's all we can do.
Yeah, and it's amazing work, because it needs to be, yes, certainly desexualized. It's just talking normally about any part of our body. But it is really difficult working on platforms and in media that still has this undertone of not wanting it on there. We see it on Instagram a lot, don't you? We can't put up a lot of our images. Anything that even remotely represents a pair of testicles gets immediately banned from any social media. I won't name the channel, but we were on a news media outlet at 6:00, and we were talking about destigmatizing and breaking down the taboo while they blurred all of our testicles out. And I thought, oh, this is ironic, isn't it? This is the kind of work we're trying to do. We're talking about it. There's me on camera with everything blurred out behind. It's a really difficult thing to try and break down, but it's just keep chipping away at it, isn't it?
I think so. And I think, as you say, we keep having these conversations. I think that's what's so, so important. And going into communities of all different backgrounds, ensuring we reach everyone is so important. We need to put ourselves out there into communities, and people need to see people like them. So if that's in the Asian community and they see me, if they see a Black person, if they see someone who's less able or disabled, we need to see those people so people will then go to their screening. And I think that is so, so important.
So important for organisations to empower that voice, not just be at the top shouting downwards. It's got to come from the ground up. Actually, this was something I wanted to just briefly touch upon with you as well, because you're of South Asian heritage.
Yes.
And there is, as I understand it, there is quite a lot of taboo and stigma in that community. Have you found that that's been a community that you've worked with? Has that resonated?
So I do find people opening up to me, and I think that's just wonderful, because actually I know what I'm doing is also serving that purpose and serving that community. I mean, I think for me, I'm very fortunate in that because I was a doctor, I was very sort of clear cut and very open with my family. And actually, I was very adamant that this is the way I was going to deal with my cancer, by sharing awareness, by sharing my story. And actually, touch wood, I had no negative, comments from family, South Asian community to my face anyway. But I have had a close family member not maybe act in the way that they might do, because I think of cultural issues. And I think, these are things that are embedded that we are trying to change. And what was really interesting is my therapist said to me, she said, Anisha, when I go to the wards, I see all ethnicities on the wards. But actually, when I'm in my units giving therapy, they're mostly white people that are coming. And she said the one time she did have someone of South Asian heritage, she had to lie to go out of the house. She wouldn't say that she was going to therapy. And I just find this heartbreaking, and this is why I do and need to keep doing what I do, because this is still out there. This is still taboo in so many communities, and we are working so hard to break this down. Some of the most rewarding work I've done was one talk I did with Eva Peel, and I went out to Islington, and I went into a Muslim place of worship, and I gave a talk about gynecological cancers, and we went through the anatomy. And I tell you what, it was so uplifting, because I had everyone putting their hands up, asking questions about periods and vaginas. And do you know what? I just felt like they could relate to me, even though I wasn't of the same descent. I'm Gujarati. They saw a face that maybe represented one of theirs and felt really comfortable to ask that. And that's something that I'm really passionate about, reaching out and giving people a voice to as well.
Yeah, amazing. And I think, I just want to say, I'm sure I probably would have said this later, but we've been very privileged to have yourself and loads of amazing advocates, but from a medical background, yourself and Dr. Liz as well. And I think it's so important that you and other advocates out there are using your medical background to advocate in the right way. Social media can be a bit of a minefield sometimes, but we need the bastions of not only hope, but of medically trained professionals out there saying this in a way that the information needs to be assimilated. So thank you so much for doing that.
Oh, thank you.
Do you want to talk about let's talk about your book as well and where people can find that, but because if you don't shout it out, I will certainly, but also some of the amazing charities that you have done work with, because you've mentioned obviously Bowel Cancer UK, Eva Peel. Anything?
Yeah, so I've been appointed ambassador for both the Eve Appeal this year, which is about to be announced in about 2 weeks, and ambassador for Bowel Cancer UK, which obviously I've worked with closely. And I've worked with these two charities very closely over the years. I work with Cancer Research UK, and I've done various posts and blogs for other blood cancer charities, etc. But I think I'm also a trustee for Teens Unite, which is a teenage cancer charity. And what I love about working with them is reaching out to people that are young and identifying with their unique problems that they have, particularly with isolation, with sort of reintegrating back into education and work. So I do a lot of talks with them about how they can best thrive afterwards. And I'm also trustee for a local charity called Guts. And I am very excitedly setting up a life after bowel cancer clinic with them, which is basically turning the second half of my book into a reality. So for me to be given this opportunity and the funding to set this clinic up in real life, which has been my biggest passion project, because I found life after cancer so difficult as a doctor and as having a bowel cancer specialist in the house. I mean, we need to do better for everyone, and this needs to be equal, because we don't have good provision of life after cancer in the NHS, because the aim is obviously to get you cancer free and then surveillance.
Yeah.
But actually now people are getting diagnosed younger and younger. People are working till later and later. We need to keep people in employment, where there are hundreds and thousands of people who are in employment who've had a cancer diagnosis. 1 in 2 people will get cancer. And so this cancer clinic that I'm doing with this charity is hopefully something that other people can model future life after cancer clinics with, that will take into account all the things that I go through in the second half of my book, things I've touched on today, like, side effects post-chemo, post-radiotherapy, the impact on relationships, mental health, fertility, menopause, how you return back to work. We're going to have a clinic which looks into these and a sort of questionnaire as you leave treatment, and then how we can signpost people and help people, all guided through by a specialist nurse who can then signpost or give the information that's needed. And that is what we need. That is what I'm striving for. When we're talking about the national care plan with the government, that is something that I would love them to think about in the future, and something that I'll definitely keep chipping away at West Streeting for. Don't you worry.
Oh, absolutely. Sounds like the kind of thing every NHS trust should have in-house. That sounds absolutely amazing. Well, I'll be knocking on your door for some tips when that comes along, so we see if we can bring that to our community. But that sounds absolutely incredible, and what an amazing culmination of what you've been through and what you've put back into the world. To see this coming to life must be so unbelievably rewarding.
It's so exciting. And as I say, the book came about only because I was writing through catharsis, and someone said, you've written all this stuff now, you've got all this information, why not disseminate it? And actually that's what I've done. So the first half of the book takes you through specifically bowel cancer and the diagnosis and treatments and how you can manage, and tips for carers, loved ones, or people who are just genuinely interested in learning about bowel cancer. And the second half is for any cancer, and it takes you through what you were saying earlier about all those things that can affect anyone with any cancer. I talk about quite candidly, relationships and how my husband and I sort of got back on track after cancer. And, we talk about everything from sexual relationships to managing your stoma to how you talk to your employer about when you return to work, because these are the things that's really hard to find in one place. And there are brilliant charities, again, like people like Macmillan, that can really help with work and things like that. And I've worked with them on this. But I think there's room for more information. There's never too much information. And I know I was like a rabbit in the headlights when I was with my diagnosis and trying to muddle my way through afterwards. If I can lend a hand to someone else with that book and make them feel less alone, that's something that's worth doing.
Sounds like something everyone should have for those horrible stays in hospital, or when you're on a chemo drip, perhaps something, or even family and friends to read, because that. Yeah. So I think we should send them. Where should we send them? Where you get the biggest cut of money, Anisha?
So it's called Everything You'd Hoped You'd Never Need to Know About Bowel Cancer. It's available in most places, but you can get it off Amazon. And yeah, I hope everyone takes something away from it, because, it was written written with that purpose for any reader.
Amazing. Thank you so much. This is the part of the podcast where we usually ask all our guests 5 quickfire questions, if that'd be okay.
Go for it.
So, quickfire questions. What advice would you give to someone who's worried they might have cancer?
Go and see your GP. Is that all right?
That's a perfectly quickfire answer. Yep, I think we covered everything about what they need to do in that GP appointment earlier. So I think that's perfect advice.
Yeah, I think if you're ever worried, you should just go and see your GP. Nothing is ever going to be too small. And if I just get to reassure you at the end of it, that is my job done as well.
Absolutely. Always say that 2, 3, 4 minutes of maybe if you're mildly uncomfortable is worth it in a doctor's surgery to get rid of that anxiety and that worry out of your head.
Totally.
What was the most impactful thing someone did for you after your diagnosis?
The silent things. So not waiting to say, what can I do for you, but just doing it. Just doing it, just turning up with a food passed on the doorstep, just saying, I'm going to bring your kids back from school, just saying, I'll take you out for a walk later. Just doing it. Because sometimes actually I didn't, as I said to you, head in the sand. It wasn't because I was ignoring everything. It was because I was so overwhelmed. So if people can just get on and do it, all the better.
Yeah, let me know if there's anything I can do question is so difficult because it's well-meaning, yes, but it puts all the pressure on you to then come up with something when you've got no more capacity, right? It's just come and do some stuff. The food one is 101. Everyone says that. Just get me a takeout. 101, drop some lasagna or something at the door. That's happy days.
Yeah, absolutely.
Brilliant. Question number 3. I hope there's nothing that anyone said, but what's the worst thing someone has said to you about having cancer?
It was actually to my husband, and they said, oh, she must have done something terrible in her last life. Oh.
Wow.
Yeah. So yeah, no, it's very, the other thing that I've had was, oh, well, you won't be wearing a bikini after all that surgery.
Oh my goodness. Oh dear. Yeah.
I have apologized since, but I think it's that it's not knowing what to say sometimes, and that leads to sort of nervousness and sometimes answers that, yeah.
Sometimes silence is better. Just saying, I don't know what to say is better than saying something completely daft.
Correct.
Oh, Christ. So learn from that. Anyone listening, not things to say. What advice would you give to someone recently diagnosed with cancer?
Lean into those around you. It's so important to just lean in. Don't feel like you're a burden. If it was you, if it was the other way around, you would be wanting someone to lean into you. So please, please, please take all the support that you can. The waiting is the hardest bit. It utterly is. And I say this to my patients all the time. I said, this bit is the worst. And just lean into everyone and take all the help you can.
Fantastic advice. And then lastly, what's the biggest lesson you've learned from having cancer?
Oh, that's a good one. The biggest lesson I've learned is to never say never. I think there was so many times that I said, oh, I'll never run a marathon. I'd never, be on TV. I'd never write a book. To be honest, I didn't even think about the latter two, let's be honest. But now I never say never. Because actually I ran the marathon with a bit of my major bowel cut out. Let's forget that I ended up in hospital a week later, but I still ran it. And my surgeon always says to me, never say never to anything. And I think that mental strength that I have now is so much more than I had before. So, never say never.
Absolutely love that. What a great place to end the podcast. I know I've said this already, but thank you so much for everything you do. Thank you so much for being here. Thank you for advocating for the entire community and more people outside of the community with all the things you do, both as a GP and as a cancer advocate. I've got 2 major notes here. One is post-traumatic growth, which I just absolutely love. And then I think the biggest takeaway that everyone's going to take from this podcast is make fibre sexy. That's the next slogan.
That's my slogan. I'm going to have a t-shirt, actually, make fibre sexy. I'm going to get a t-shirt, totally. But no, thank you so much for having me. I've really enjoyed it.
Really appreciate your time. I can't wait to see what comes next. We've heard a little sneak preview of some of the things, so we'll be keeping a close eye. Thank you, Anisha, so much.
Thank you so much.
Thank you for listening, and thank you to our amazing supporters and funders who make this podcast happen. If you enjoyed this episode, please give us a review and follow us on social media at Thrive Against Cancer. And be sure to check out our other episodes wherever you listen to your podcasts and on YouTube. If you want to help support our mission to give a voice to the cancer community, please contact us or visit our website to learn more at thriveagainstcancer.co.uk.